everyone. My name is Sharon Lagas, and I'm the co-founder and past president of the Alport Syndrome Foundation. More importantly, I'm a patient, a mom, a sister, and a daughter of other Alport patients. We have had 7 family members diagnosed with Alport syndrome across 3 generations. And I'm here today to talk to you about being an effective self-advocate. For people living with a rare disease such as Alport syndrome, learning how to advocate for your own health care and that of your family is extremely important. This is something that we've had to learn as a family and are still learning today as our journey with Alport syndrome continues to change and evolve. Simply put, self-advocacy is learning how and where to get information to understand your disease and speaking up for yourself and your loved ones in decisions affecting your health and treatment. It sounds simple enough, but it can be very challenging. It also changes as your disease changes. You'll have different needs depending on where you are in your disease journey, whether you're just newly diagnosed, you're planning a family, during your routine monitoring, or when you're going into kidney failure and hearing loss. I do feel that there are 4 key important factors to empower yourself to self-advocate. 1 is being an active partner. 2 is educating yourself. 3 is connecting with others. And 4 is being prepared. And I'm going to discuss each of these in the presentation to follow. Being an active partner. The first item here is knowing your rights. And I put this here to remind us that as patients, we're just as important as the doctor. Too often we go to the doctor and we let them tell us what they think and what we need to do without really voicing our concerns and our questions. It's our doctor's duty to answer our questions fully and make sure that we understand our disease progression and the treatments that they're recommending or not recommending, as well as the implications. But we also need to make sure we are asking and being honest with our physicians. Having a rare disease such as Alport syndrome means that your doctor most often has not seen many Alport patients. And this is an opportunity for you to help him or her by bringing as much information as you can to your appointment. Personal information on how you're feeling or coping, or information that you might have on treatments or clinical trial information that you've gotten from resources like the ASF website and other resources. The next item is knowing your responsibilities. It's critical that we adhere to any treatment or recommendations that the doctor gives us. If you can't adhere to them, then you must be honest and tell your physician why you can't. If you begin experiencing side effects of the treatment, it's important that you let your healthcare team know. Many of us, including myself, often feel that the doctors are so busy, you don't want to bother them. But the only way that we can get effective care is if we're honest and we're communicating with our healthcare team. This is getting easier with the use of apps and portals to be able to message your doctor and your healthcare team, and it's particularly important as we empower our teens and young adults to advocate for themselves. It's also our responsibility to ask for additional help if we need it. We know the kidney diet can be very challenging, so asking to see a dietitian or a nutritionist might be appropriate. You might need to speak to a genetic counselor or a social worker if you're having challenges, difficulties dealing with the disease from a mental health perspective. So it's very important that if there's additional resources that you need, that you voice that to your healthcare team. The next item in being an active partner is finding the right physician. And ideally, you should have a physician who's an expert, a nephrologist who's an expert in kidney disease, or an audiologist who's an expert hearing doc, and that has seen Alport patients. That is the ideal situation, but we know that this is not always possible. Some people live in a rural area. So really the most important criteria for finding the right physician is finding a doctor who you feel respects and listens to you, where you feel an equal and respected partner. They answer your questions without getting impatient and help you to understand your disease. It's also important to find a physician who works well with your children, as they can help you and your child understand their disease. This is critical as your child becomes a teen and has to take ownership of his disease and its treatment. Transitioning from pediatric to adult care is much easier when your teen or young adult understands their disease and what they need to do. So taking these three things together is what I call an active partnership. The next is educating yourself. Becoming confident in your understanding of Alport syndrome will help you be a better advocate. The ASF website has a wealth of information. It has written information, like the example here on the slide, but then it also has links to videos with the experts, as well as links to videos on the YouTube page, which there's some great videos on just the basics of Alport syndrome, which might be very helpful in showing to your teen. So that's probably number one, is just understanding the basics of Alport syndrome. Number two is learning about the treatments and just having a basic understanding of what are the current treatments for Alport syndrome and when they're recommended. And on the ASF website, there are several resources, and there's one that's geared towards patients and families that has a lay summary or a simpler summary for families. And then there's also the article that can be printed out that you can bring to your physician, and you can talk about it with your physician if you choose to do so. And then the third item is just understanding and knowing which are key lab values that you should keep an eye on. And you can discuss these with your physician. These will change over time, but basic things like GFR, glomerular filtration rate, it's a mouthful, but that basically tells you where you are in your disease progression, what stage of kidney disease you're in. So that's important to keep track of. A couple others are creatinine and perhaps uric acid, and then there's dietary values to look for, potassium and phosphorus. So just knowing a few of the lab values that are key and important and being able to follow them is important for you to understand where you are in your journey and to be able to ask appropriate questions. You can also feel free to reach out to ASF representatives at any time if you have any questions about anything that you've read on the website, or you need to find other resources. Connecting with others. Well, we all know that living with a rare disease can be overwhelming and very isolating. And connecting with other patients and families and drawing upon our shared experiences is very helpful and very empowering. That's why ASF was started, because there was nobody to talk to when our family was diagnosed. I co-founded the foundation in 2006, and I still find that connecting with others is the most powerful tool I have in dealing with this disease. I look to others who have experiences that I haven't had yet, and I learn from them. So I encourage you to reach out in any way possible. You can never underestimate the impact of one patient on another. And you know that you are just not alone. There are resources for you. ASF has a very active Facebook support group. There's about 2,000 members on there. So that's one option for connecting. Another is our ACT, or our Alport Connect Together meetings. Those are our family meetings, and those are for all members of the family, from the adults, caregivers, to teens, young adults, and younger siblings. We have a patient ambassador program, and the patient ambassadors are in all different experiences with the disease. So there's male and female, there's older, there's younger, there's moms, and they're willing to work with you to help you advocate for yourself, come up with the right questions, and just they've been there before, and so you can draw upon their experiences. There's ASF events throughout the community, that perhaps there's one in your state or nearby where you live, that you can connect with other families. And the last one is, just pick up the phone and call us the old school way. There's somebody that's always here to answer the phone and to talk to you and to get you the best resources that we can. So I encourage you to connect with us in whichever way resonates best with you. Being prepared. So I can't stress enough that being prepared before your doctor's appointment allows you to maximize the time that you have with your doctor. I mean, this is valuable to those that are newly diagnosed, to those that are seasoned patients. Having a written list of questions or any changes or physical side effects that you're experiencing, or a list of topics that you want to talk about, topics such as, transitioning from pediatric to adult care, or perhaps, you're looking at dialysis. Having those ready before the appointment will allow you to get the most information that you can out of the appointment, and perhaps let you plan for the future. If transitioning is something that might be coming up in the next year or two, talking about it beforehand is much more helpful than being caught behind the 8 ball and having to do it at the last minute. One of the ways that we do it as a family is we keep a running list on either our phones or our tablets, or even a written list of all the items we want to discuss or clarify with the doctor before our appointment, so that we're not all left there saying, what was that we wanted to talk about? So that we find that very, very helpful. Know your medications. That's important. And we now have the medical ID on our phones, and there's other apps that you can keep track of your medications, or you can always do a card in your wallet. That's very helpful as well. One of the things that I found very important is getting my labs before I go see the doctor, so that we can discuss my labs during our appointment. It does require some coordination, and I know many doctors and healthcare teams do this, but I would want you to make sure to do that before your appointment, so that you can discuss your labs during your appointment and not have to try and get in touch with the doctor afterwards, which can often be a little difficult. I also believe it's important to have access to your lab results over time, so that you have them and you have access to them. And that's, again, getting easier with apps and portals, but you can always use paper copies if that's what's available to you. And I just like to note that if you do have a written list before you go into the doctor, that would help empower your team to be able to ask them their own questions, or it would perhaps help somebody who is maybe on the shyer side or less assertive to help them navigate their appointment. Bringing someone with you, I would recommend that if at all possible and you're open to it. It's 2 heads are better than 1, but it's always nice to have somebody else as backup to ask questions and to process the answers, so that you can have somebody to discuss some of these things with after the appointment. And last, again, it's important for you to find out how to contact your healthcare team and who to contact them and what's the best way. Email, app, phone, but that's very important as well, how to follow up with your healthcare team. The next slide is a list of questions that I think are applicable to any appointment that you have at the doctor. It's certainly not an exhaustive list, but it's a basic list of questions for you to ask. I know that there are many other questions you can ask if you are at a different stage, such as transitioning from pediatric to adult care, or perhaps looking at dialysis. So that's where the resources at ASF could come in. We can hook you up with a patient ambassador that has that experience and has already been through that can help you develop questions to advocate for yourself and your loved ones, depending on where you are in your disease journey. This next slide I put in here as a reminder for women in our community that your health is just as important as your son, your child, your brother, your father. We are often busy taking care of others, and we may neglect our own health in doing that. And I just want to, make a note that women with Alport syndrome most of the time are not carriers. They have the disease, just a different progression of the disease. So it's key that we are being followed by a physician and we are on the proper treatment and medication. It's also important that young women understand how having Alport might affect family planning and perhaps pregnancy. So even if the women are not progressing or young women, it's important that they are seen by a physician and they have a good understanding of their disease as well. And last, it's important for us to be role models for our children and other family members to show them how to manage their health responsibly. And last, I just want to tell you that you're not alone, that we are here for you. We've been in your shoes. We know what it's like to grapple with these challenges, and we're here to help you. So please contact us, please reach out to us, and we will provide you with the best resources we can. Thank you very much for listening to me today.